Be talking about MS, the link between MS and fungus. So, this will be part one of a several part series, really focusing on the types of infections, the types of parasites that cause multiple sclerosis. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. Over 35 years ago, I was diagnosed with multiple sclerosis. And by the grace of God and a lot of work on my part, I learned early on that MS is an infectious disease caused by various types of parasites. And actually, the first type of parasite that I learned about was Candida, and which is a type of yeast, which is a type of fungus. So we're going to talk about the research, how far it goes back, and all kinds of things, symptoms of fungus, different types of fungi, how to treat them, because they are one of the infections that we do need to treat to recover from multiple sclerosis. And also, really important nuggets that I have learned from not only my own recovery, but also in coaching hundreds of people all over the world, like more of the realistic role that fungi plays in multiple sclerosis and other chronic diseases also. So, the wonderful thing is that over 40 years ago, there were several hero doctors that were talking about how MS is caused by infections in the body. So, I found these books shortly after my diagnosis of multiple sclerosis. And when I was diagnosed with MS, I went to a university MS hospital clinic, one of the best in Canada on the West Coast. The neurologist there did all his tests and he diagnosed me with multiple sclerosis. And he told me back in the day, 1988, that there was nothing that I could do to change the course of my life, that I would be completely disabled in time. And I left his office so devastated. I thought that my life was over. I was a healthy person all my life. And then all of a sudden, I was stricken with this incurable mystery disease. It just didn't make sense to me. But thanks to my amazing faith in God, because I have asked for a lot of help and He has answered a lot of prayers, my mother-in-law found this book. I received only one book, and this book was The Yeast Connection by Dr. William Crook. And that was an MD doctor, at least 40 years ago, talking about how Candida was one of the infections that really is linked with not just MS, but all kinds of other chronic diseases. So, long story short, I read that book, and that book gave me some hope. I didn't know if I'd be able to cure myself, but it gave me hope that maybe there was something that I could do to take charge of my health and to get my health and my life back. So, long story short, I've been MS free for over 35 years. We've developed a program to help people recover because that is my passion. I actually went back to school, became a certified, first of all, got a science degree, then became a certified teacher. So it's really relevant to the work that I do. I had another child, so I have 3 children, I have 7 grandchildren now. And I've had the amazing privilege to coach hundreds of people all over the world. And so we've learned a lot. And I want to give you the nuggets of the really important pieces of wisdom that we have learned, again, by the grace of God and the work of many wellness champions in their recovery following the Live Disease Free plan. So these doctors, I wanted to share some of their names because they are really amazing doctors. So there's Dr. William Crook, Dr. Orion Truss. Let me know if you've heard of any of these. So Dr. William Crook wrote The Yeast Connection. These books are so old, you can probably find them in, if you go to a library, you can probably find them in a library. And that's what I would do. I wouldn't buy them because they're quite dated, but it just shows you that there were forward-thinking doctors years and years ago, decades ago, that were treating infection in their patients. So Dr. William Crook wrote The Yeast Connection, Dr. Orion Truss, The Missing Diagnosis, Dr. Luc de Schepper wrote Candida. It's a little book called Candida. And Dr. Zoltan Rona is a Canadian doctor. He wrote the comprehensive Candida guide, which I purchased many years ago. So these are old books that I've had around for decades. And they were some of the first doctors that gave me hope, that really introduced me to the whole notion that MS is caused by different types of infections. And back in that time, they really focused a lot on Candida. they definitely wanted to help people recover from parasites, but they didn't have as much knowledge about the other types of parasites as they did about Candida at that time. And so that is when I found their work. And the way that I found their work was because I didn't have the internet back then. Dinosaur ages, right? So I had no internet, I had no computer in the house. I would go down to the library and do research, but I would find their books through this little magazine called the Alive magazine, which we would find in our health food store. And they always had a book review. So I would get that. It was always a free magazine, get the magazine, kind of go through it a little bit, but go to the back, look for the book review. And there I found these books. I mean, besides the one that my mother-in-law gave me, that really started me on this journey. And so I really believe that God gave me that first book, The Yeast Connection by Dr. William Crook, to help me to see that there is another way. There is a better way to treat MS and all chronic diseases. So I decided to take that different path. I decided not to follow standard of care for MS because it gave me no hope for a cure. It literally was for me to be losing my life. So I decided to take that path. And it's been really, really productive and really helpful. And I'm really grateful to these amazing doctors. Years ago, I actually wanted to share their books with you here. I pulled some of them up here just so you can see they're really old. And I also wanted to give a shout out to Doug Kaufman, who is the founder of Know the Cause. He's a dear friend of mine. I've been on his show at least a couple of times, maybe 3 times, I can't remember, but he is the fungus guy. He really knows a lot about fungi, and you'll find his program on different stations. Also, you'll find on YouTube and on Facebook. Knowthecause.com is his website. And this is just one of his books here. Amazing, amazing person. He's very, very knowledgeable about fungi, about Candida. And then this was Dr. Luc DeShepard's book. It's kind of wore out a little bit. I've had it for, again, decades, Dr. Luc DeShepard. And then there is the Yeast Connection Cookbook. Here we go with that. Just wanted to share these classics. This is part of my book collection of like 40 years ago or 35. And then there is The Missing Diagnosis by Dr. Orion Truss, Dr. Orion Truss. And then this was the Complete Candida Yeast Guidebook, and that is by Dr. Zoltan Rona, a Canadian doctor, a wonderful Canadian doctor who has been helping. So these are, I call them hero doctors, doctors that years and decades ago, they were heavily ostracized by their peers. You know, like, no, you have no idea what you're talking about. Candida cannot cause issues, cannot cause disease, cannot be part of disease. And they were helping people recover. So what they found is that when they helped people to treat Candida, and a lot of them used herbs. So just to know that antimicrobial herbs, medicinal herbs, they will treat Candida, but they will also treat other types of small pathogenic bacteria and also other types of small parasites. So they probably didn't know that they were treating Candida, but they were also treating other types of parasites. And that is another reason why their patients did so well. So again, they found that by treating infections in chronic disease, that they were able to stop the progression of disease, and they were able to help their patients have a lot of recovery, more recovery than they ever thought possible. And for some people, full recovery, which is so incredibly exciting. So with respect to fungus, we know that there are at least 400 different types of fungi that can cause disease in humans. Just one sec here. So there's at least 400 different types of species of fungi that can cause disease in humans. And we're going to just talk about like Aspergillus, which is a type of mold, and we'll talk about Candida, which is a type of yeast. But just know that there are many others that can cause disease in humans. And fungal infections or fungal overgrowth is really common in people that suffer from chronic disease. Many types of disease, not just multiple sclerosis. And fungus has a great ability to suppress the immune system. All right, there's many different mycotoxins that are poisons produced by different types of fungi. And so the fungi will produce these poisons. So directly and indirectly, they will cause inflammation and immune dysfunction and immune suppression. And so that's why we need to pay attention to different types of fungus becoming part of the infections that we need to treat to recover from MS and other diseases. So with respect to Candida, we know that Candida is normally, it's a type of yeast, and it is present in all of us. So it's called commensal. So it's not just present in people that are really sick, but it's present in small numbers in people that are healthy. And when we go on antibiotics and we eat a high processed carbohydrate diet and we have high stress and we don't have a healthy lifestyle, then this yeast that's living in us in very small numbers, then it starts to change and it turns into, like, from the cell form, like a round cell, it starts to grow roots called hypha. And so this root structure, I talk about this on my masterclass training, and you can see pictures of it there. It actually creates this root structure that goes through the intestinal lining, can break into the bloodstream, and can just grow deep in our tissues. And that is a more invasive Candida. It's harder to treat. It's more of the pathogenic form. And so it changes. Like, normally it's just hanging out, not causing any problems, but with the disruption to our microbiome, especially because of the overuse of antibiotics and of course our lifestyle and our diet, then it changes. And so many of us, we just ignore the symptoms of fungal overgrowth because we don't really know what it means, and we don't really know that we have fungal overgrowth. I was going to say, make sure to type your questions or your comments in the question box as I'm talking, because I'd love to go back and answer your questions later. Like, I'll go over the symptoms of fungus, of Candida, etc., and see if you have any of these symptoms or if you have had them, because it's really common. So we know that Candida can produce at least 70 different poisons, mycotoxins. There are many cousins of Candida that can cause disease. So it's not just Candida albicans, it's different types of Candida. But some of the toxins that they produce, so they are massive producers of ethanol, the yeast, and that's a type of alcohol, and it can make us feel drunk. It can make us feel dizzy and foggy head, and basically the medical term for this is called autobury. So if we have a lot of yeast inside of us and we're eating a lot of carbohydrates, the yeast will ferment the carbohydrates, and that will cause us to feel like we're drunk. And that medical term, again, is called autobury. Candida also produces a lot of different types of mycotoxins, such as formaldehyde. And in small amounts, it's not an issue, but it can really cause disease and death, these mycotoxins in larger amounts. Neurotoxins like acetaldehyde, you might have heard of, when you feel like you were hit by a truck, if you drank too much alcohol the night before and you have a hangover, that hangover feeling is from the chemical acetaldehyde. It is the hangover chemical. And it just makes us feel like we just want to lay down. And very often, like when we eat a high carbohydrate diet, then these yeast and other microbes will produce a lot of alcohols and make us feel like we're drunk, or make us feel like we are hit by a truck. That's what I used to say when I was really sick at the start. I'd say to my kids, I feel like I was hit by a truck. Candida infections and other parasites, they can also cause leaky gut, where food that is not properly digested, or other things, even pathogens, different disease-causing microbes, they can actually cross the intestinal wall and move into the blood and move into different parts of the body. Also, then we can have food sensitivities. We can be sensitive to different types of foods that we should not be sensitive to. Candida also can produce tons of organic acids, which really make us acidic. And when we're acidic, then we can become deficient in minerals. And that is a really big problem, because when we're deficient in minerals, then our body is not going to operate properly. And so we can have disruptions in minerals, disruptions in electrolytes, can make us feel, depressed and anxious and insomnia. So like all of this disruption to our nutrition can affect us in many different ways that we really haven't even thought about. So we can end up being really acidic because we are, number one, our food is deficient in minerals, but then secondly, they're massive producers of acids. And also I've shared with you on previous blogs about how they cause acidosis, right? All the acids produced by yeast and other pathogens causes us to have acidosis, too much acid present in our body, deficiency in minerals, and then all the consequences of our physiology in that respect. Yeast can also produce leukotrienes, which are the chemicals involved in asthma. And so where we have the tightening of the airways and we have a lot of mucus produced. There are other parasites that can also cause the symptoms of asthma, but definitely yeast can also. Yeast can also produce prostaglandins, which are the pain chemical that we may find if we're dealing with endometriosis or migraines, etc. Premature labor also. So prostaglandins are produced by our body in response to parasites, but also these fungi, the yeast can also produce prostaglandins themselves, this pain chemical. And so what do? We reach for the drug ibuprofen, which it really decreases the presence of prostaglandins, but it's not treating the root cause. And why not treat the root cause? Because we have the highest level of health then. So the overuse of antibiotics and the disruption to our microbiome, and along with our highly processed carbohydrate diet, is really the environment where Candida thrives. And it changes from that, like the benign cell form, into the pathogenic disease-causing form, which is like a root structure. So in the research, later you can go to livediseasefree.com, and in the main menu, you can click on research and then go down to MS is an infectious disease, and you'll see the link between MS and fungus. You'll see the studies there. And there are many different studies where they have found a higher incidence of Candida infections in multiple sclerosis patients, higher levels of antibodies, and also Candida antigens, so antibodies against Candida, but also antigens or like not metabolites, but parts of Candida that are present in MS patients versus healthy. So much higher in MS patients than in healthy people. They've in the blood and the spinal fluid. And so they've also found Candida or fungi in the nucleus of brain cells. And that's crazy. So there is a lot of research. It's not really popular because it's kind of like, well, you can treat fungus with different types of antifungal medications. So they don't research a lot. But knowing that when Candida is present in high numbers in the body, that those poisons can really impact us. Like, why aren't our doctors treating fungus more? When they know we have symptoms, why don't we really test for it? If we have a yeast infection, they might give us a 1 to 3 day course of fluconazole and that's it. But they're really sheltered from the research of how significant fungus is in chronic disease and multiple sclerosis, and why it needs to be knocked back and managed. And yes, we knock it back with different herbs and parasite or fungal drugs, but we also want to use lifestyle, because fungus it's giving us a sign of what's going on in our body. So it's not just, like you have this fungal infection for no reason. It's people that have fungal overgrowth have a suppressed immune system. All right. So yes, when we go on antibiotics, it definitely puts favor on fungal overgrowth, but people that are dealing with a lot of fungus, what we have experienced in our students is that there are other parasites, bigger parasites, that are suppressing their immune system. And fungus also loves to live in an environment where there is a lot of garbage. They are the recycler of the world. So when we have bigger worms that are releasing bacteria, so we've got a lot of dead bacteria, also the waste from the larger parasites, fungus thrives in that, and it loves to recycle materials. And so also those parasites, the bigger ones, will suppress our immune system directly. So with direct immune suppression and then also making an environment that is favorable for fungus to grow, we end up with fungal overgrowth issues, and that has to be treated. We have to knock it back, and then we have to recognize, we want to knock it back to the point where we don't have any fungal overgrowth symptoms. And then we want to manage this. That's the really important thing. And as we age, right, our immune system is not as strong, also probably because of the increasing dysbiosis, being out of balance, too many disease-causing microbes. And so fungus is definitely, we have more fungal symptoms when we are older, when we're elderly. Thrush also is more common in MS patients. So thrush is an oral infection where we can have like a rash inside of our cheeks. We can have a white tongue, a coating on our tongue, and it can be quite uncomfortable. And that is also a symptom of fungal overgrowth. So the studies show a presence of high levels of antibodies against Candida, and also the Candida antigens, which are proteins in the blood and the spinal fluid of MS. So this is documented science. It's not anything that I've come up with. And so we do see symptoms, but they have confirmed this in science. There's also a specific enzyme that becomes more active, a Candida albicans enzyme that is really more active in multiple sclerosis, especially when we have more severe cases of MS, like the progressive, more advanced MS. The sicker we are, the more disabled we are, the more active. And all of that makes sense because the sicker we are, the more infested we are with parasites, the more our immune system is suppressed, the more fungus is going to thrive because of all the garbage from the other parasites, plus the suppressed immune system. So it all makes sense. And then with respect to mold, if like with some of my students, they've lived in moldy environments before they became sick with MS or another chronic disease. And so if you've lived in a moldy environment, the mycotoxins from the mold, they are some of the most toxic substances in the world, and they directly suppress our immune system. And when our immune system is suppressed, then we end up getting other parasites too, because the primary job of our immune system is to defend us from parasites, to defend us from different types of microbes that would cause us harm. And so when we're living in a moldy environment and we're breathing in the mycotoxins, whether it's at work or whether it's at our home and it's damp, fungus loves damp, then over the years or over months and years, we end up having different pathogens or parasites becoming more of a problem because our immune system is more suppressed. So one would be aspergillus. It's a type of mold. I know one of our students years ago it's called meningioma, and that is a benign tumor in their brain. So she had multiple sclerosis and she had this meningioma, benign tumor in her brain also. So as she followed the live disease-free diet, decreased her carbs a lot, because the mold, the fungus, the yeast, all of them, they love carbohydrates. All the parasites do. So as you decrease the carbs a lot and you get ready to treat and you start treating, the symptoms start to subside. And her meningioma tumor disappeared over time. First, it became smaller and smaller and smaller. And then the specialist said, "Oh, I guess you don't have that anymore." And then as she recovered from MS, he said, "Oh, I guess you never had multiple sclerosis." Right. So that's an exciting thing, is that when you have the right environment and you support your immune system, then your immune system is better able to help you in defending you against these types of infections, the mold, the yeast, etc. So really important to deal with mold, to make sure you don't have mold. Like if look in your bathroom, sometimes some of my European students, they might even have mold growing on their wall in their laundry room or on their wall because they live in a damp environment. Make sure to check your roof, that there's no leaks in your roof. Make sure to check the basement is not musty smelling, because that makes you very, very sick and weak. And then you need to treat not just Candida if you have it, but you would also need to treat mold. And a lot of our students test well for medications to treat yeast, but also to treat molds. So one study showed that exposure to mold and the mycotoxins that they produce can affect the nervous system directly and or through immune cell activation. So I will have all of this information on, and these studies, again, linking to livediseasefree.com under research, but also we'll have a blog post posted at the end of the week. And so you can go to livediseasefree.com and you can just type in, MS and fungus, and you'll see it there. So symptoms of fungal overgrowth. So a lot of these will be Candida, but not necessarily. They can be mold also. Allergies, sinusitis. Let me know if you can relate to any of these symptoms. Allergies, sinusitis, asthma, snoring, dandruff, vaginal yeast infections, rashes, eczema, and fingernail or toenail fungus, jock itch, rectal itch, psoriasis, gas, bloating, constipation, irritated dry lips, rashes on the inside of your cheeks. That's the thrush we were talking about, ringworm, cancer, penicillin allergy, sleep apnea. So those are just a few symptoms of or conditions that where fungal overgrowth will be present. All right, so now how to treat fungus. Go ahead and type your questions in the question box and I will come back to those. Number one, diet is super important. Back in the day when I read all those books by doctors, many of them recommended this Candida diet where we get rid of gluten and we have no dairy and we have no sugar. And those are like the minimum that we would do in recovering from disease. But with the Live Disease-Free diet that has been developed over 35 years, we found that by going a little lower with the carbs, removing the grains, especially for people that have serious chronic diseases, it's night and day how much better they feel when they decrease the carbs enough. So getting down to about 30 total grams of carbs per day. I'm not going to go into the diet today. We'll do that on another day, but I have all of the guidelines free on our website, livediseasefree.com. So when you get the carbs down to about 30 to 40 total grams of carbs per day, people notice significant symptom improvements in their fungal symptoms, but also in other symptoms. So things like rhinitis. So that is a condition where I've shared it in my book, Become a Wellness Champion. So Become a Wellness Champion is our book. And I talked about a study where they scraped the sinuses of 200 people and they found that I would say 98% of the people that when they looked at what they scraped out, it was fungal overgrowth in their sinuses. So when we have chronic sinus issues, I'm not talking about the acute infections that occur, but if you're chronically stuffy and chronically mucousy with no significant bacterial infection, that is like 98% of the time, that's fungal overgrowth in the sinuses. And so as people are decreasing their carbs and they're treating parasites, their sinuses drain and they clear up, right? The rashes go away. Their toenail and fingernail fungus goes away. All of the symptoms, dandruff, all of these other symptoms go away. So it's really important that we are not just popping a pill and just carrying on with our life because, yes, there were parts of our lifestyle that brought us to this place with fungal overgrowth. And so we really need to adopt a few different types of lifestyle choices along with knocking it back and then building back that good and healthy microbes. There's a really huge link between cancer and fungus also that I've talked about in other, and also Doug Kaufman talks about that also. So number one is following the diet, getting your carbs down really low and really starting to enjoy the benefits by following the Live Disease-Free diet. The second step is to support the body. So this is where we make sure we're having daily bowel movements because a lot of us are constipated. And then also making sure we're sleeping at least 8 hours per night, staying hydrated, reducing toxins in the environment, making sure we don't have mold in the environment. Also, paying attention to the EMF and RF radiation around us in our homes especially. Nowadays, all of our appliances are smart. We might have some transmitters outside of our home, radiating the radiation into our homes, the routers, the computers, the cell phones. So there is a lot of radiation that we're exposed to right now, and that makes these parasites, the yeast, fungus, mold, more virulent. They grow more quickly. They produce more poisons. And so we want to clean up that environment that's invisible to us. And then building a healthy lifestyle, bringing oxygen into the body, being active as we can, as we're improving, right? When we're feeling better, starting to take back our mobility, all of those things, our body uses oxygen to help kill different infections like Candida infections. So it's not like we're replacing our immune system. We are helping our immune system, supporting it, and then we're expecting that it is going to help us to recover from fungal overgrowth also. And then you need to treat it. So it's not enough to manage it with diet, because our body will maintain a specific blood sugar level to keep us alive. And that blood sugar level in our blood will will continue to allow the fungus to live in our body, and it's not going to die. So we can't kill the fungus in our body with diet. We can definitely make it less active, make it more quiet, but we have to treat it. So this really involves, you've got to work with a healthcare professional. If you are struggling to find healthcare professionals that will really help you, that's what we help people to do in the Live Disease-Free plan. We help them to access treatments, to access practitioners they need, to do it in the most cost-effective way, because you don't need a lot of supplements, you don't need a lot of tests, you just need to start to get ready to treat, and then we're energy tested to see which treatments are helpful. So if we have a lot of, yeast that we've been exposed to, like Candida, that's been growing in the body, then something like fluconazole is going to test well for us. If we lived in a moldy environment, then something like Sporanox might test better for us. And then nystatin is more of a gentle drug that works more in the digestive tract, and we can use that with the other fungal drugs. So some of our students test better for fluconazole, some test better for itraconazole or Sporanox. Some students test well for both, and then they also test well for nystatin. There are a lot of herbs that are antifungal, but if you have chronic disease, then it's probably a better idea to, as you're working with your practitioner, if you tolerate it, of course, they have to look at your health history and your blood work, etc. But using things like fluconazole and itraconazole work more systemically, because again, if we have chronic disease, we have fungal overgrowth throughout the body and into the central nervous system. So it is helpful to knock it back a little more aggressively. And then once we have no more fungal symptoms, then we could maybe just rely more on herbs. But this is like an ongoing thing. It's not like you're going to treat fungus and you're going to be good for the rest of your life. You're going to pay attention to symptoms, and periodically there are some wonderful herbs. If you're healthy, but you've got like tiny little warning signs, then you can just simply use some different herbs and the oxidizing agents, etc. That will be helpful. All right, I'm going to go to your questions. Let me just see here. There it is. Awesome. So, hi, Julie. Yes, you had those symptoms, acid reflux. So, acid reflux would be more H. pylori, which is a bacteria. So when we have a lot of parasites, we're in this pro-inflammatory state. And to keep it really simple, there's different pathways, and we'll call it the H1 pathway, where you're like the inflammation is really high in your body. And inflammation is measured in different ways. So just C-reactive protein is not the only way to measure inflammation. But when we have parasites and our immune system is in this constant fight mode, then we can end up with our stomach acid becoming lower. With lower stomach acid, then bacteria likes to grow in the stomach esophagus area and cause acid reflux. So be careful, because what our standard of care would say is, oh, you have too much production of acid, so we're going to give you an acid blocker. We're going to give you proton pump inhibitor. And so when you further decrease your stomach acid, that is very dangerous, because we need our stomach acid to help us digest our food, to just help the whole process of digestion. And also, if we ingest pathogens, that stomach acid helps to kill pathogens. So it's part of our defense to protect us. And if our stomach is not acidic enough and we eat, different types of parasites, then they're going to just go through the digestive tract and establish themselves in our intestines and then move into the central nervous system. So really be careful with that. What all of the experts are saying that is the opposite is that, you have low stomach acid if you have acid reflux. So number one, following the Live Disease-Free diet. Number two, taking extra HCl, so betaine HCl. Of course, everything I'm sharing with you is for educational purposes, Julie, and all the questions that are being answered. I don't know you personally, but I can just say research this, right? Or you can work with us, and then we will help you to make sure to put a plan together that works for you. But you want to increase the stomach acid so that the bacteria, and you may have to treat the H. pylori, right? You might have to have a test. You might have to treat that bacteria. And then as your stomach acid is built up again, then you're treating all the other parasites, then you don't have to worry about acid reflux in the future. That is the best way to go. And you have food sensitivities and insomnia. And so that's a really good point. And I want to really stress that. So back in the 1980s, when I got those books, the doctors were talking about Candida is the cause of everything, right? It's the big culprit. And so now, 35 years later, with everything we've learned, and make sure to check out our livediseasefree.com blogs, the articles that I write, and just look at the different topics and pick and choose the topics that you want there. You can skim through my notes really quickly. You can watch the videos. But what we're seeing now is that, yes, we are treating fungal overgrowth, but we are not seeing dramatic shifts in symptoms from treating fungal overgrowth as we do for treating protozoa and different types of worms and bacteria. So it is something that, yes, we do need to treat and we need to knock it back. And we need to take, things like chlorella, which will bind to a lot of mycotoxins. But just be aware that what we thought 35 years ago, we're not seeing that is the biggest cause of MS. We're seeing that the worms, like when the students are recovering from these worms, when they're on the antiparasitic drugs, it's life-changing, especially when you are using the right treatments for the parasites you have. Also, the babesia, malaria, the Lyme disease, all of that seems to be making a bigger difference in people's symptoms when they're treating them. But we still do treat fungus because all of them will suppress our immune system, making us more susceptible to other parasites in the future. You're very welcome, John. Good to see you there. How much antibiotics is too much? Actually, one course of antibiotics, a lot of people will notice that they have more Candida issues, right? And they'll have to take diflucan after the antibiotics. But if you have an acute bacterial infection, whether it's dental, whether it's a bladder infection, you have to use antibiotics. You don't want to hurt your kidneys, your bladder. You don't want to hurt any part of your body. If you have an acute, like your teeth, you've got to deal with it properly. But then once you've dealt with it properly, then you can start following the Live Disease-Free plan, all the steps. You can watch that in my masterclass training. And then you are doing things in a way that you are treating the root cause, you are building up your immune system, you're building up your health, and then you won't need antibiotics in the future. I have not used antibiotics since I was very, very like a teenager, I would say. I was on tetracycline for months, which is a broad spectrum antibiotic. And I never had yeast infections, like vaginal yeast infections. I did have a lot of constipation. I didn't have fingernail or toenail fungus, not really dandruff. So I didn't have a ton of fungal symptoms. Back with those doctors that wrote those books, they really talked a lot about constipation and gas and bloating was caused by fungus. But now we know that yes, they're caused by fungal overgrowth, but they're also caused by different types of worms. And even things like malaria, babesia can cause digestive issues. So there's many different microbes that can cause issues in the gut. So there is a time and a place for using antibiotics. And if you have to use them, they can save your life. But then you need to take charge of your health and you need to support your immune system, treat the infections, restore balance, and maintain that. And that's what I've done for over 35 years. And I have a very, very full life. It's almost too full right now. Like I have 7 grandchildren, which they come first, and my children, right? And then we live on an acreage and I'm outside and I'm shoveling manure in the morning before work. I've got a horse learning how to ride again, and we've got chickens and sheep and 2 dogs and just a small acreage. And so it's a lot of work, but that's healthy for me. It gets me away from the computer. I'm probably healthier now than I've been for the last few years because I'm outside, at least a couple, 2 to 4 hours a day before and after work. Unfortunately, it's dark now. It's getting to be fall again. So I'll be out with my little light, but nature feeds my soul also. So the key is that it's really important to learn this skill yourself, because then you can manage the microbes in your body in the most cost effective way. You know your body the best. You know when something's working and when it isn't. And you have that skill for life. So it saves thousands of dollars on surgeries that you don't have to have, and medications and testing that you don't have to have. There is so much evidence that all chronic disease, including heart disease, autoimmune disease, and cancer, they're all infectious diseases, and MS also. And so this is a skill that you need to learn. And fungus is definitely a part of that. And it definitely needs to be knocked back and managed, right? We can't sterilize our body, but we can definitely manage. Somebody's saying, I thought you said inflammation. So inflammation is war. So think about it: when you have your immune system is fighting some type of infection, that is inflammation. So that's the war zone between your immune system and parasites. And any microbe that lives in your body that causes you harm is a parasite. So parasites can be worms, can be bacteria, fungi, and protozoa. Those are kind of the four bigger categories of parasites. And so all of those parasites can cause inflammation, right? Because our immune system is going to fight anything that is going to cause us harm. And when you have the parasites decreased, then your immune system does not have to work as hard. But it's always on guard to protect you. What do you think about hydrogen peroxide IV therapy? I think that, Julie, that it's fairly expensive. We use an oxygen therapy. You can actually look at the video. It's on Rumble. I don't believe that I did it on YouTube because it would be censored. So you can just do a Google search, livediseasefree.com, oxygen therapy used to treat parasites, or just live disease free and oxygen therapies used to treat parasites, and you'll see that. Or go to our website, you'll see the blog post. So there's a really cost-effective oxygen therapy that you can use from your own home, from the comfort of your own home. You can put the pressure on the parasites every hour if you like, and that really helps to treat, like to bring in that type of a treatment in a very cost-effective way. So oxygen therapy is really there's ozone also, but I do have an ozone generator, but it's not as easy as this other oxidizing agent, and I can't say the name of it because it's so heavily censored. So when can you start treating? What's really important is that you get the carbs low enough that you're feeling a lot better, that you're having daily bowel movements, and that you're sleeping at least 8 hours per night. Those are the three main criteria that we use before we do any kind of treatment. We can use that oxidizing agent to do enemas earlier on. That's fine. But you definitely do not want to start treating before you're having daily bowel movements, sleeping at least 8 hours per night, and you're following the diet, low carb, live disease-free diet, because that really helps you to be successful with the treatments, right? Like, you're not going to pop a pill and recover from fungal overgrowth. It's not going to happen. If you keep feeding the fungus and you're trying to hit it with herbs and even the fungal drugs, sure, while you're on the fungal drugs, you'll notice that the fungus will be decreasing a little bit. But as soon as you go off the fungal drugs, they're going to come back with a vengeance. So it's really important that you do it in that specific order. John, can you buy a mold test kit at Home Depot or Lowe's? Maybe you can. I don't know. There's something called an ERMI test kit that you can use to test for mold in your home. ERMI, you can just Google search it, and I'm not sure where you would find that, but that would definitely be helpful. What are the good medications to fight mold and Candida? So I said fluconazole, which is called diflucan. So fluconazole is the active ingredient of, it's like the drug, and the brand name is called diflucan, and that'll treat more yeast types of fungi. The drug that will treat more of the mold types of fungi would be the brand name is Sporanox, but the active ingredient of that drug is itraconazole. And there's a lot of other fungal drugs, but those are two really common ones that doctors know of that are really readily available in different pharmacies. You have to get a prescription. You have to work with some. Another thing I wanted to mention too, never mix these fungal drugs with other parasite drugs. You can do a search and you'll see that fluconazole and itraconazole, they react negatively. You can have negative or bad drug interactions between these fungal drugs and many other medications. So never, just to be on the safe side, don't mix these two fungal drugs. So some doctors will use nystatin capsules with other parasite drugs, but definitely do not mix the itraconazole or fluconazole with other parasite drugs. Nystatin, I don't recommend the liquid nystatin because it has sugar in it and sugar feeds yeast. So you can find capsules, or it used to be tablets of nystatin. Nystatin is more of a gentle antifungal medication, again, requires a prescription. It only works in the digestive tract. It's not going to be hard on the liver. It's not going to have to be metabolized by the liver, but it will not work systemically. So when we have chronic disease, remember I was talking about how they're finding antibodies for Candida and antigens for Candida in the spinal fluid, nystatin isn't going to reach there. The immune system will definitely help if you decrease the burden in the intestines well enough. But if you do want to knock it back, these two drugs are tolerated really well, as long as, you definitely, our students will have their liver and kidney function tested before they use any parasite drugs. Again, you have to work with someone. You have to do this safely. And okay, I answered that. Allergies, gas, asthma, ringworm. Yes, I actually had ringworm as a child too. Maybe I got it from my horse. I used to have a horse, and my sister had a horse when we were younger. Ozone in the nasal, you have to be really careful with ozone. You're not supposed to inhale it, so I would not inhale it. Very important, because it's too toxic for your lungs. Anything containing citric acid, which is basically anything, is mold. Your thoughts on this? So it's really important. Like, number one, I don't take a lot of supplements. And yes, you're right. You have to definitely, as far as the citric acid, I think that it would be filtered out well enough that you're not going to have mold components in it. Like, they'll be isolating the citric acid more. So I don't think that will be a problem. But why do you need the citric acid, right? That's the important thing, is what are you taking? A lot of us don't have to take a lot of supplements. We shouldn't be taking a lot of supplements. So your blood work came back and your glucose was at the bottom of normal, very low. I guess that's an indication that you're doing well on the diet. Yeah, so it's still in the normal range, but it's a little on the low normal. You're following the Live Disease-Free diet. So you're not in ketosis. We really don't care. We're not focused on ketosis. We're just focused on decreasing the carbohydrates that are reaching our intestines, so that that's where the biggest bulk of the fungus and of the other parasites, that's the biggest base camp, right, of all the parasites. And so this is where we really focus a lot on. And some of the other treatments, we're going to do, several parts talking about the major infections that are causing MS, but it's really important that we do focus on the gut. And yes, some of the other parasite drugs will help to work more systemically, but it's not just going to be fungus. So that's the big silver lining that I want you to know, because there are still a lot of doctors that are like talking about Candida, and they're talking about Candida diets and how Candida causes everything under the sun. And that has not been our experience. Our experience is that we're noticing bigger neurological shifts for most people when they're treating the other parasites. So the protozoa can cause a lot of problems. The worms can cause a lot of symptoms also. So keep that in mind. Yes, knock back the yeast, but don't make that your focus, because you'll find that you're like, well, Pam, that didn't really make a big difference in the disease that I'm dealing with. Again, does this help with progressive MS? Cheryl, I talked about like one drug that has helped multiple sclerosis is, I believe it was a study done for progressive MS with hydroxychloroquine. So that's a really big clue because hydroxychloroquine treats malaria, babesia, protus. Again, remember I talked about how fungus is not the main culprit. So that is another clue that, and you can find that on livediseasefree.com. Also, you can just do a Google search of live disease free and malaria drug helps MS or hydroxychloroquine. You'll find it and then read that. So, and I've done a 5 or 6 part series about the link between malaria and multiple sclerosis. And when I did that, it's not saying that malaria is it, because we know that babesia and malaria are very similar parasites that infect our red blood cells. And I've talked about how MS is more of a vascular disease, all the research showing that, and how these parasites that infect our red blood cells, they make the red blood cells sticky, they clump together, it decreases our blood flow, we have more strokes and microbleeds, etc. So yes, you're going to knock back fungus in the process, but when we're treating parasites, we'll do like 14 days of treating the worms and the protozoa. Then we will do 10 days of treating fungus, whatever we test well for. Then we will take a break week. And during the break week, we're not doing nothing. We are just focusing more on like herbs, and we're using that oxygen therapy. That's one cycle. So we're going to do multiple cycles of knocking back the different types of parasites. And for some people, it might take 3 to 6 treatment cycles. For some, it might take a year to a year and a half. But this is why you need to work with somebody, because you have to make sure that you're making adjustments. So you might test well for, let's say, some worm medications, but maybe you also have this huge babesia infection. And sure, you might be passing worms and feeling a lot better, but you still have maybe some symptoms of babesia, which is like air hunger, can affect your heart rate. It can affect fatigue, all kinds of symptoms. Go and look at the symptoms. So anything that's malaria will also be babesia. They treat them the same. They're very similar protozoa that infect our red blood cells. They're parasites that infect our red blood cells. And that looks to be like one of the main culprits in multiple sclerosis. So yes, you will be treating Candida or mold or both when you're recovering from progressive multiple sclerosis. Can this help with insomnia? Absolutely. Absolutely it can. So number one, diet will help with insomnia. And then also we have to understand, like when you look at all our work, you'll understand that you're more acidic. When you're more acidic, you're not going to sleep well. So you really want to be bringing in lots of minerals and electrolytes. That helps us to sleep better too. And then as you're treating the parasites and you don't have all of those different chemicals that are produced, all of that helps with your sleep. And then you can be more active, and that also helps with your sleep. I think that is all that I wanted to share tonight. We've gone an hour here, so I think that I'm going to call it quits here. So I just wanted to thank you so much for spending this time with me. I really hope that this helps you to see that there is real hope. You're the only one who can make that shift away, like I did. When I shifted away from the standard of care for treating multiple sclerosis, which gave me no hope for a cure, and I decided to figure out what types of infections I was dealing with. Of course, it took a while. I didn't have a coach. I didn't have a proven plan. It was a lot of trial and error. But look where I am today. I'm literally riding horses again. I am playing with my grandkids. I'm carrying my grandson. He's like a heavy, heavy boy. And my granddaughter, like they're 4-year-olds, and I can carry them up hills, and I can just be as active and play with them on the trampoline. And serving people all over the world, helping them. That is why we do this in the Live Disease Free plan. Marissa is a Live Disease Free coach, and Caroline's been working with me for years. And we are here because we want this for you. We're wrapping up 2024. Before we know it, we're going to be at Christmas. And you have to make that decision. Do I want to stay on this path that I'm on? Or do I want to take a different approach? Do I want to follow a different approach, take a different path, and try to figure out what types of infections I'm dealing with? Make sure to watch my masterclass training. On that, I share many of the different types of parasites that are really common in multiple sclerosis. I also share all the steps that we take to recover, a lot of case studies of amazing wellness champions that have recovered, some of them already for 8 or 9 years by now. And then if you want support, if you believe in your heart that you are dealing with different types of infections, chronic parasitic infections, but you don't have support of a doctor, you don't know of somebody who can help you, make sure to reach out to us. And all that is you watch my masterclass training, fill out a form, and then if we feel that you're ready, then we will send you a link. You can book a time to chat, and make sure to watch the coachathon, because that really explains all of the steps that we do in the plan, so that you really have better questions for me when we meet. And you can join before we meet, you can join after we meet, just to make sure to answer your questions, to make sure it's a good fit. And then you are well on your way to recovering from MS or other chronic disease before the end of the year, so that you can make 2025 the very best year that you have had in many, many years. And that is your decision. But please, life is too short. Really consider to study this and to really understand and to talk to doctors. Try to find someone. Again, if you need help, we're here to help you. That's what we do. And we work with students all over the world, in Europe, United States, Canada, Australia, New Zealand, Caribbean, everywhere. So we're here for you if you need us. And again, I've got a ton of information on our website, livediseasefree.com. Also, our guidelines for the diet are free. Livediseasefree.com. Under research, you'll find the Live Disease Free Diet Guidelines. Start to change your diet. You will be shocked at how much symptom improvement you have when you decrease the carbs. That's going to help to build your belief in this approach. And then if you need help, reach out. So with that, if you enjoy all the research that I'm doing for you, you can help us to share the word, to get the word out by just liking, sharing, and subscribing, so that we can help to bring change to how we treat chronic disease. It is time. It's past time. We need to help our healthcare professionals know that they can treat the cause, that there is a cause, and we do that early, if we can, doing that early, so that we can avoid a lot of pain, suffering, and cost. So with that, I hope you have a wonderful week. Take care. Bye-bye for now.